Let's talk about why healthcare in the US costs so much compared to everywhere else, even though there's been attempts for years to bring prices down. The most recent push was the healthcare plan President Trump rolled out, with goals like cheaper prescription drugs, more transparent pricing, and lower insurance premiums overall. On paper, it sounds great, but in reality, it's a lot trickier than it looks. Take prescription drugs. They're expensive, and a big reason prices shot up decades ago is because developing new life-changing medicine takes years of research, clinical trials, and a lot of failures before something actually works. So when a drug does work, this company gets a patent, meaning they're the only ones who can sell it for a certain period of time. During that window, they set high prices to recover their investment and to fund the next breakthrough drug. Once the patent runs out, cheaper generics enter the market and prices do usually come down. But in the US, there's also middlemen, like pharmacy benefit managers, who negotiate discounts for insurers. To offset those discounts, companies sometimes raise their list prices even more. In other countries, governments negotiate drug prices directly, which keeps costs lower across the board. Trump's newer approach tries to move in that direction by tying US drug prices to the lowest prices paid in other countries. That's also where TrumpRx.gov comes in, offering coupons for discounts on over 40 popular brand name drugs if you're paying cash. It does help some people, but in most cases, generics are still the smarter and cheaper option. And it's not just drugs. Another major frustration is not knowing what your care will cost until the bill shows up. There's been an attempt to require hospitals and providers to post real prices online. The idea is more transparency, but it's not perfect. Some providers adjust prices for cash patients, but not for those with insurance. Compliance isn't always complete because posting and updating prices is complicated. And even if you do everything right, your insurer still might deny the claim. Sometimes those denials are even driven by AI systems without a human reviewing the case. That can leave patients stuck paying more out of pocket. And all of this connects back to insurance premiums. As healthcare costs rise, premiums rise too. And if healthier people drop their coverage because it's too expensive, that leaves a sicker pool of people insured, which drives the price up even more. So the bottom line is American healthcare is one big interconnected web. When you change one piece, it creates a ripple effect somewhere else. That's why costs stay high, even after years of reforms and promises. This newest effort has parts that could help if they're handled carefully, but it's gonna take time to see whether it actually lowers costs in a lasting way without creating new problems along the way. Thanks for watching.